March 19th, 2025, and it's 10:33, and we're here to review the jail fill-in, and I will turn it over to the Sheriff's Department.
Yeah, so we're just here to kind of give our update of how it's going in the jail, and we said we would meet after a month or so to kind of brief of what it's costing us to have patrol fill in and where we're sitting in the budget. So I just kind of printed off a few and highlighted the jail budget so you can see what they did. Oh, if you want one there. Yeah. So if you just look, I highlighted we're at 42% of the year. Salaries for the jail, we're at 33% of the budget used, so we're about 9% under budget right now, which is calculates out to like $53,000 under budget in salaries right now. And then they went ahead and created a line in there that says jail fill-in. Mm-hmm. So what we've been doing is all the patrol deputies that work on their time card, they write it as jail fill-in, and then it actually comes out of the jail budget. So that portion of their pay is coming directly out of the jail budget, so we won't have to transfer money. Mm-hmm. So you can see last month we used $7,500 in jail fill-in. And that's just all patrol deputies working in the jail. So we had quite a few signing up and working. It helps a lot. We had several major incidents in the jail over the last month, fights and that kind of stuff, and it was definitely a benefit to have them there to help. So The jail is way over capacity right now. We're at like 55 to 56 inmates right now. I just sent an email to the IDOC because about 23 of those are state inmates and they're not taking their prisoners, and so I did send them an email saying we want some response and that they need to take more of their prisoners because of our staffing levels and housing abilities. We cannot facilitate that many safely. So
Can you clarify what the state inmate means, that it's not?
It's an inmate that's sentenced to the Department of Corrections that's awaiting transport.
Are those local charges mostly?
All of them are local. They're not ones that we're bringing in. They're all ones that have been sentenced here locally, and then they're supposed to come and get them, but they've just been using us as like a holding hub. Mm-hmm. And in the past, when we have room in the staffing, we can hold 20 of them, but right now we can't safely accommodate that. So I requested to them to get that down to more like 10 state prisoners is what we could probably safely hold right now. And 23 is like way over what we should be holding for them right now. So we'll see if they respond. And
so what's the longest term prisoner in those 23 that you guys have?
Right now we have a female prisoner who's been in there over 900 days, almost 1,000 days.
Wow. So
she was charged. Go ahead, Commissioner.
Yeah.
She was charged with the homicide in Smelterville in 2022.
So she's spending a big bulk of her term
here
instead of in the state pen.
Yep.
And the state reimburses us for this, right?
They do, and we get the $70 per day per inmate, but when your inmate costs are close to $100 per day, I mean, a lot of that of the cost is deputies and stuff who have to be there anyways, but it's still probably they need to look at adjusting it through the state again, probably raising it up again. A lot of places that house prisoners for other places have started raising their fees. You know, it's getting more close to that $100 range per day to house an inmate.
Do we have any control over that?
That's actually set by the state. What they'll pay for the state prisoners.
I will include that we're not the only county having this issue with IDOC. Multiple counties are having issues with IDOC not taking inmates in a timely manner after they're sentenced. So it's definitely not just isolated with us.
Yeah, I read where Ada County had a big problem, and then they were going to force them to take them, and then they came back to the bargaining table because the state doesn't have the room, and
Yeah.
that's pretty.
Yeah, at the end of the day, the inmates just end up sitting in the county facilities because the state they'll just say, we don't have the room, we don't have the staffing. Well, neither do we. And it needs to be, if we request you to move them, you should be moving them. And I don't care if you have the room or not, because we obviously don't have the room in this tiny little jail to hold that many, and with only 4 detention deputies right now actively working, like we can't
Yeah,
be overstaffed, overpopulating
that's-
our jail that much.
And
So
paying medical and
Yeah,
everything,
paying-
it all adds up.
that's one issue. So that's one issue we're trying to address, because if we could get that population more like the 40 prisoners or so, it definitely would ease some burden for the low staffing numbers we have.
Are we responsible for their medical, or does the state reimburse?
State reimburses
State
for
Okay.
reimburse.
Yep.
Okay,
So
so they do reimburse that.
yep. Yeah. I guess I would just ask that we continue allowing the patrol to fill in. We currently have 0 applications for the jail, so that still has not been fruitful. We have a couple potentially in the fire.
Yeah, just this morning, a
Mhm.
previous employee that had quit wants to try it again and see how she does. So that's good news. We'll see how that goes. And then we have one more iron in the fire with an employee that worked with us before, who's would be considered a kind of a lateral deputy if he's able to do it. But that would be 2 experienced deputies making a comeback to the jail, which would be great. So we're just kind of keeping our fingers crossed on that one.
I also heard the prosecutor referred a couple of folks affected by the federal roofing, that he referred them to your office for potential for employment.
Great.
So these would be some kind of federal workers with some experience, but I don't know if they had a background in law enforcement or what, but they were interested. So
Yeah, it doesn't even matter if there's a background in law enforcement. That's a plus, but it's definitely not. Most people that apply there have no experience at all. So.
And you've got everything on. You've posted that on Idaho Department of Labor.
I think Julie's still doing
Yep,
Okay.
Julie is.
theirs.
Okay.
Yeah.
Okay.
Yep. Yeah, we got them posted.
Okay.
It is on the county side though.
Yeah.
Okay.
Yeah, and we posted the courthouse security yesterday.
Okay.
That all got posted. We're actually interviewing a guy who's interested in it right now. He's retired law enforcement, so he's over there interviewing. He said he was interested in that position, so we'll see how that goes. And
when does that position vacate?
well, Leroy, he's kind of up in the air on, and I've had some conversations with him that if we do end up hiring somebody else, potentially he could train that new person and then just continue to assist in the jail until, because we're not going to hire 5 or 6 people in the jail in 3 months. So, but more than likely he'll be gone this summer. So
Do you want to talk about the idea for
the health.
medical?
Yeah. So we also met with another gal who was affected by the federal layoffs or whatever. She was part-time firefighter, and then also works in the hospital part-time. And we were kind of looking through our policy, and it talks a lot about this health-trained staff, having health-trained staff in the staffing, and they don't necessarily make medical decisions, but they're the person who works directly with the jail medical. So they would, anytime a new inmate comes in, they would review the medical screening the deputies did, and then contact the jail medical if they're in need of any further follow-up and that kind of stuff. She would prepare all the medications when they come in, so she would get training in the actual preparing the medication. So when new medications come in, it's not like you have to document it in the way we document it in the jail. You have to make sure that the right medications are started, the dosages might be changed. There's a lot to it. And I think definitely feel it would be a step in the right direction and at a minimal cost that we could cover in the salaries we already have in the jail.
So basically, what we're thinking, so this applicant is a firefighter, EMT, phlebotomist, currently working at a hospital, doing those things. So our idea is to take a deputy position, and instead of hiring an actual deputy to do that position, we create a new position called the,
This would be a jail tech slash health trained staff. We'll come up with like the exactly what it'll be called, and we figured we're just kind of bringing up the idea now, and then we'll probably come back to the table with you guys with like what their job duties will be and all that.
Okay.
And
basically that position, instead of having multiple deputies focusing on medical care, one deputy will focus on medical care, and one deputy will be the liaison to the doctor. One deputy will ensure that the medical, like if they have to do medical checks every so many days, that's being done. So one deputy will be responsible for the medical, which is the end goal. I ran it by iCrimp when they came to do some training with us, and I did EBOC training. Anyway, it's fun. They said it's a great idea. So just something we're throwing around out there, but I think it's a really good idea. Just take that deputy position, fill it with a specialized medical position.
So she's an EMT? I'm sorry, Dave. Go ahead.
yeah,
That would buy us, all the other deputies, more time to work with inmates and
yeah.
just trying to deal with medicine.
Correct.
Yeah, the problem with the way we're doing it now is too many hands in the cookie jar. So if everybody's responsible, nobody is, and if you get one person on it who's dedicated, that's their main focus, is to make sure those needs are kind of met and that they're working directly with the jail doctor. It's going to be way more efficient.
It's also way easier to supervise one person managing that than trying to supervise multiple people managing the one. So
Right, yeah.
And then, yeah, we talked to her because she wouldn't be able to fill up a whole day just dealing with that. So she would, starting out, work as a jail tech too, which would be helping with bookings, court, guard tower, all that kind of stuff. Just helping the deputy that's on with all the extra stuff.
her end goal though is to become a detention deputy.
Yeah.
But this would also give her a chance to see if she even wants to do that position. But either way, it benefits us.
So I don't know if that's something you guys even need to approve, or we just do it, or I was thinking maybe meet next week or something and just come up with by then I'll have a whole list of duties for them. We'll have the title, what it's going to
Pay
be,
scale.
what the pay scale will be for it, and all that. It'll be pretty much in line with the detention deputy pay, but we'll do it so we don't have to create like a whole new line or anything. We'll try and figure it out, so it should be all right.
All right.
Appreciate the creative thinking.
Mm-hmm.
I know we got lots of problems to try to solve and lots of limitations on manpower.
Yep. Yeah, and applicants aren't flooding down the door, so we're trying to get creative to bring people in and get them working in the jail. So, yeah. So the only other thing I just want to bring up is the 12,000 that was kind of put in there into that jail fill-in line. We'll probably be over it by next month.
Okay.
If we go another $7,500 for the month, we'll see at the end of the month where we sit, but we're enough under budget between the jail salaries and the jail benefits. The jail benefits is only at 30%, so that's like another, that's 12% under budget right now. So that's like another 50,000 under budget we are. And then if you look, just kind of go to the end, the overall budget, we're at 35% in the jail of the 42%. So
Yeah, and I kind of figured that out last month where you did have, more than 12,000.
yeah. So we're sitting.
That was 12,000 a month is
Yep.
what at that time, but there was money before that we didn't capture in that.
Yeah.
Yeah.
So yeah, we said we were just going to meet with you every month or so to evaluate, make sure sitting all right in the budget, and it looks like we're fine so far. Everything's looking good. As we bring on, hire on staff, hopefully is the plan and the goal, then we'll have to adjust the amount that the patrol can fill in.
Okay.
But until we get people hired, I would just like to continue allowing the patrol to fill in as much as needed.
Okay.
Because so far we seem to be well within budget doing it, and
Okay.
allows them patrol guys to make a little extra money and benefits the jail a lot. So
And it shows patrol that the working detention, you know, it's not a boring job. You're busy,
Mhm.
you know, and it's kind of helping the team kind of come together in ways that they've never done before. So
Yeah. Bridging the gap.
bridging the gap.
Yep.
We even have dispatchers that we've trained to help book people in and stuff. So everybody's just kind of working together to make sure that we get through it.
Okay. All right. That's good.
Yeah, so I guess we just get put on for next week sometime or whatever for that, and we'll brief on that position and then try and move forward with that.
Okay.
And then
During that time, I would like to talk about, if we could include it in the same meeting, patrol staffing, because that's starting to change as well. And
Yep.
I should probably brief you guys on that.
Okay. Do you have any other questions?
I would just recommend on the calendar that we just discuss sheriff's office staffing in general next time so that they can cover everything.
Any questions?
No.
Public comment?
I think the question I had, you're taking the benefits out of the jail for the fill-in patrol people. Is that right? Okay. My last one, just so you know, talking about hiring a medical person, this isn't the forum for it, this is for jail fill-in. The medical person would be a budget meeting. I believe it's a separate entity or separate deal. To me, a lot of this stuff shouldn't even have been talked about. It's for jail fill-in this meeting, that's it.
Okay.
So, thank you.
I apologize, Matt. That's probably my fault.
Well, that's why we wanted to have a follow-up meeting so we can actually. I just like.
Understood, but this one was for just jail fill-in.
Yeah.
All right. Thank you. All right. Nothing further?
No, sir.
Meeting adjourned.
All right. Thanks.
Thank you.